This is Average Joe PT. We're here to reduce anxiety, improve function, and master your pain. Isn't that right, Skull?
We're here to master your pain, and we're going to talk about the SI joint and give you some treatments.
That's right, that's what we're going to do today. Now, today, we're going to go over the SI joint. Now, if you're new to this channel, we'd love to have you subscribe down below, hit the bell. Skully and I, we bring content once or twice a week. We do lives on Wednesday evenings, Eastern Standard Time between 6 and 6:30. So what we're gonna do today, talk about the SI joint, maybe hit a little bit of the lower back at the exact same time. We're gonna go over treatment techniques that you can do at home to help reduce that SI joint pain. So hold back, hang on, here we go. All right, Skully, hit him with those digits.
We're going to be going over this SI joint, and you better listen.
That's right, that's right. Those digits, this SI joint. Now, this little joint right here can give you a lot of pain. Sometimes it's coming from your back, sometimes it's coming from this SI joint. Now, we're going to go over some different treatment techniques, some mobilizations that you're going to be able to do to reduce this SI joint pain. Now, there's a couple of philosophies out there. I'm going to give you a little clip here in a snappy second, and it's going to go over two crazy guys with two different ideas. Here we go with that crazy nonsense. Well, I'm Dr. So-and-so, and I know everything about this little joint here, and everything I say is always correct. And guess what? Yes, this joint right here doesn't really move. That's right. Nope. It's not really a joint, it's just kind of stuck in place there, and when you bend forwards, it doesn't really move at all. Of course not. Of course that thing doesn't move at all, because I'm Mr. Know-It-All. I'm Mr. Dr. So-and-so. Well, Dr. So-and-so, I'm Dr. Cool Cat, and I'm going to tell you here right now that that joint does move. It does when you bend forwards. The joint does go in the opposite direction. It can give you pain. It does have enough movement to give you pain, Mr. So-and-so. So, you think you know everything, doctor. Well, I'm a doctor too, and I'm going to tell you right now that this joint does do some movement, and guess what? If you do some injections in that area, it actually does reduce some of the pain, and that's a good sign that that's where your pain's coming from in the first place, Mr. So-and-so, Mr. Know-It-All Doctor. Now, whether you're in the Cool Cats arena or whether you're in Mr. Know-It-All So-and-so's arena, we're going to go over all types of techniques that you're going to be able to do at home to try and figure out whether you're having an SI joint pain or whether you're getting some pain from your lower back going into the SI joint. As well as we're going to go over some home treatment techniques that you can hopefully do to resolve that SI joint pain in the first place. Now, hopefully at the end of this, you'll be able to figure out whether you're going to focus on your lower lumbar back or whether you're going to focus on your SI joint. So stick around.
We're on the floor again.
I know I'm on the floor. I have to be on the floor to show them this stuff.
Well, I'm not coming down there.
You just stay up there, you'll be fine. All right, folks, we're going to go over some of the techniques and treatments of mobilizations. And we're going to start out with, right now, number one, called the shotgun method. All you're going to do is basically pinch your fist, hold, 1, 2, 3, and relax. Then push on the sides, making sure that you give equal pressure through both legs. Push again, and you might actually get a pop in the pubis or one of the SI joints if it's stuck. That's a simple mobilization technique that you can do. Mobilization technique number two, let's say it's the left side that's hurting you. You're gonna drop that right leg down, and you wanna give equal pressure to your knee coming towards your face and equal pressure to your hands coming towards your knee. And you're gonna hold for 3 seconds and then relax. You might even wanna push down the back of your right leg down into the floor and hold each for about 1, 2, 3 and relax. And what will happen is we're trying to pull and rotate that hip back. Now, depending on which side that's hurting, you might need to switch and do just the opposite and hold for about 2 or 3 seconds and then relax. Hold for 2 or 3 seconds, pushing the back of your left leg down into the floor while you bring this right knee towards your chest, and you should feel those SI joints. If they're stuck or stiff, you might get a pop or a click, and hopefully that pain will go away for you. So that's mobilization number 2. Now, you can go ahead and try and get that piriformis muscle activated to maybe if you have a tilt in that sacrum a little bit. So you're going to keep your feet together, open that knee up. We're going to say it's the left side. You're going to push your knee into the hand and that hand into the knee. You're going to hold for 2 or 3 seconds and then relax. You're really going to feel that back in this area because you're really getting that piriformis muscle to activate and then relax down. And so that's a nice mobilization technique you can do to hopefully, if you have a tilt in your sacrum, that can help too. Unless you'd have to go, if you're having any pain, you might have to go and see a therapist in the first place. But these are some good techniques that you can try yourself to see if you can just fix your symptoms pretty quick. Once you get those muscles to relax, a lot of times everything starts to resolve itself anyways if you had a little bit of a click or a shift in your SI joint or a tilt in your sacrum. What do you think about that, Skully?
There's some real good treatment techniques here, people.
I know, I'm showing them good techniques. Let's do a stretch here. Simple one's piriformis. I like to be in this position because the spine is completely supported. We're going to stretch the left piriformis. So you're just going to collapse those fingers together, pull this knee towards the opposite shoulder. Not getting any rotation, just getting a nice little pull. You're going to hold for 30 seconds to a minute, and then you relax. You can go ahead and repeat that once or twice. Now, just do one side, whatever side's hurting. Don't end up doing both because one side's probably stretched out anyways. Usually the side that is hurting is usually the side that's probably tight because it's contracted. Next, what you're gonna do is just kind of straighten that leg out. Nice little hamstring stretch because those hamstrings are attaching to the butt bone back there. Hold for 30 seconds to a minute and then relax. You can go ahead and do both sides on this one if you like. As my foot comes right out of the screen. Boom! You might get a nice little pull right down the calf depending on how irritated that is. Hold for 30 seconds to a minute. Some nice strengthening exercises you can go right into. One of them is that nice piriformis, okay? I'm gonna leave a little link down below. Show you some rubber bands. Put the rubber bands around your knee and you can open and close that way. So I'll leave a link for the rubber bands. Next what you can do, go ahead and tuck your legs in, tuck your feet in and just lift that leg up. Pause and then back down. That's a nice stretch you can do. Strengthening exercise that you can do for your hip. And then you can roll right onto your stomach and just lift that leg up and down 2 or 3 seconds and then relax back down to get your back glute muscle. That's a nice simple strengthening exercise you can do without bands or with bands. You should be doing these exercises until you feel a little bit of fatigue. That way you get some muscle failure going on. That way you can get some strength out of those instead of just doing reps. You want to get those muscles to really fatigue out. Now, I always go over on my playlist. You can look over a TENS unit, hot packs, lidocaine patches, massage techniques. I have in my playlist that you can easily do on if it's your left piriformis or SI joint or your right. You can go ahead and incorporate some of those types of treatment techniques as well as the ones I'm showing here today. Isn't that right, Skully?
There's some real good treatment techniques here, people.
Yeah, I know. Yeah, exactly. So what are we going to do next, Skully?
I don't know. You tell me.
What do you mean you don't know?
Yeah, I don't know.
I told you earlier.
You didn't tell me anything.
Well, listen. All right, folks. Wait 1 second. We'll be right back. I got to talk to him for a second. Skully and I, we want you to look at this playlist up here. This goes over all types of back issues that you might be having, disc problems, stenosis, postural issues that you might be having, and treatment techniques that you can do at home to help alleviate some of those issues. Now, Skully and I, we want you to come back and see us over and over again. We love to see you guys coming back. If you have any comments, go ahead and leave them down below. Skully and I will try and get to them as soon as we possibly can. But until next time, we're going to look up and keep smiling.